So let us discuss about anatomy basics since it's part 4. We know about brachial plexus, so very important anatomy question. So it includes C5 to T1, C5, C6, C7, C8 and T1. From the root, it will be divided into 4 parts: roots, trunks, divisions, cords and branches. So roots from C5, C6, C7 you will be having long thoracic nerve and nerve to serratus anterior. Trunks, from trunk there will be branches, suprascapular nerve and nerve to subclavius, which is roots and C5 and C6. So C5 and C6 forms a medial trunk. C8 and T1 forms so it is divided into upper trunk, middle trunk. C7 forms middle trunk and C8 and T1 forms lower trunk. This upper trunk gives anterior and posterior division. Middle trunk gives anterior and posterior division, and this lower trunk gives anterior and posterior divisions. The anterior division of the upper and the middle trunk joins to form the lateral cord, and this lower trunk anterior division forms medial cord, and posterior division of all the 3 trunks gives rise to the posterior cord of brachial plexus. Just remember this mnemonic: from the lateral cord, LML, lateral root of median nerve, musculocutaneous nerve and lateral pectoral nerve, whereas medial cord of brachial plexus 4MU, which is your medial pectoral nerve, medial root of median nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm and ulnar nerve, whereas posterior cord of brachial plexus gives rise to ulnar. Just remember this mnemonic: upper subscapular, lower subscapular, thoracodorsal nerve, radial nerve, axillary nerve. Brachial plexus injury is a very important clinical significance. Long thoracic nerve injury causes winging of scapula. C5, C6, this region, if there is an injury during delivery of the child, that will cause Erb's palsy. And C8 and T1 injury causing Klumpke's palsy, which is policeman dip hand. Brachial plexus will get compressed in case of thoracic inlet syndrome, like patient is having cervical rib. And this is very important: lumbar plexus T12, L1, L2, L3, L4, L5. From L5 and sacral plexus they form lumbosacral trunk. The anterior division from T12 and L1, it will form iliohypogastric and ilioinguinal nerve. Genitofemoral nerve, which is L1 and L2, so it is going to supply medial aspect of thigh and genitals. Lateral femoral cutaneous nerve of thigh, which is a posterior division of L2, L3, L4. Femoral nerve is a branch arising from L2, L3, L4 posterior division. Lateral femoral cutaneous nerve, the root value L2 and L3 posterior division. Obturator nerve anterior division of L2, L3, L4. So L2, L3, L4, anterior and posterior division. Anterior gives rise to obturator nerve, posterior gives rise to femoral nerve. And this L3 and L4 is accessory obturator nerve. So this is a lumbosacral plexus. From L4, L5, S1, S2, S3 it will form sciatic nerve. So it is having a fibular portion and tibial portion. Fibular portion is a common peroneal. Superior gluteal nerve root value L4, L5, S1. Inferior gluteal nerve root value S1, S2. Pudendal nerve root value S2, S3, S4. This pudendal nerve is very important in understanding the physiology of the bladder. Sciatic nerve course, they will ask you a very important anatomical landmark is piriformis muscle. Beneath the under surface on the lower border of piriformis, sciatic nerve emerges. It will cross obturator internus, quadratus femoris, adductor magnus muscle. Sciatic nerve on its course, it has two parts, tibial part and common peroneal part. In thigh, the branches are semimembranosus, semitendinosus, long end of base of femoris, ischial part of adductor magnus, and common peroneal part, short end of base of femoris. This common peroneal nerve winds around the neck of the fibula. Tibial nerve supplies flexor compartment of the leg. Common peroneal divides into superficial and deep peroneal nerve, and deep peroneal nerve supplies extensor or dorsal compartment of the leg. So the sciatic nerve muscular branches to the hamstrings, flexors of knee and extensors of the hip, to all muscles in the leg and the foot. Common peroneal nerve, muscles of anterior and lateral compartment, that is your extensors of toes and everters of foot and dorsiflexors of your ankle. Tibial branch, muscles of posterior compartment of leg and intrinsic muscle of sole, which is the plantar flexor of ankle, flexor of toes and inverters of the foot. Extensors in the sense like tibialis anterior, flexors of toes or inverters in the sense tibialis posterior portion. So the cutaneous and sensory branch, sural nerve, deep fibular nerve, superficial fibular nerve, medial calcaneal branches. Sural nerve formed by the branches of common fibular and tibial nerve, which is mainly supplying the lateral compartment. So this is a very important question. They may ask you the layers of scalp. Remember this mnemonic: scalp, skin, connective tissue, aponeurosis, epicranial aponeurosis, loose areolar tissue, and pericranium. Emissary veins will connect the veins from the connective tissue to the superior sagittal dural venous sinuses. Diploic veins connect from pericranium to the dural venous sinuses. So if there is an infection in the connective tissue of the scalp, it may progress to dural venous sinus thrombosis. Adrenal gland anatomy. Adrenal gland is divided into cortex and medulla. So in this, cortex is divided into three important zones, from outer to inner, GFR. Zona glomerulosa, fasciculata, reticularis. Reticularis, androgens, testosterone, estrogen. Glomerulosa, GEM, mineralocorticoid, aldosterone. Fasciculata, glucocorticoids. They will secrete cortisol and cortisone. From medulla, there occurs catecholamines: epinephrine, norepinephrine, catechol-O-methyl transferase. Methylation of the catecholamines or norepinephrine happens at the level of adrenal medulla. With respect to the blood supply of the adrenal gland, a very important anatomical landmark. Look at the left adrenal gland. Adrenal gland derives its blood supply from the inferior phrenic artery branches, left superior adrenal artery, left middle adrenal artery direct branch from the aorta, left inferior adrenal artery which is a direct branch from the left renal artery. This is on the left side. If it is on the right side, right superior adrenal artery arising from the inferior phrenic artery on the right side, right inferior adrenal artery from the right renal artery, middle adrenal artery from the aorta. Venous drainage. Right adrenal vein drains directly into IVC, whereas left adrenal vein is formed by also inferior phrenic vein which drains into the left renal vein. A very important anatomical landmark. They may ask you about blood supply of breast. You must know the principal arteries, thereby you can able to have it. The blood supply of the breast mainly arising from the thoracoacromion trunk which gives rise to lateral thoracic artery, and from the first part of subclavian artery we are having internal thoracic artery, and this lateral thoracic artery will give rise to lateral mammary branches, lateral mammary branches of lateral cutaneous branches of posterior intercostal artery, and medial mammary branches. So I want you to know about a very important anatomical question, the subclavian artery. Subclavian artery divides into three parts by pec minor muscle. So first part gives rise to 3 branches, second part gives rise to 2 branches, third part gives rise to single branch. 3 branches: mnemonic, vertebral artery, internal thoracic artery, thyroscapular trunk. Second part which gives rise to superior intercostal artery and deep cervical artery. Third part gives rise to dorsal scapular artery. This third part of the subclavian artery which gives rise to dorsal scapular artery, and the first part gives rise to thyroscapulocervical trunk which is inferior thyroid artery, suprascapular artery, superficial cervical artery. This superficial cervical artery and dorsal scapular artery which gives rise to transverse cervical artery. So this is a very important scapular anastomosis. Thyroid blood supply, we must know superior thyroid artery and inferior thyroid artery. Superior thyroid artery is a branch from external carotid artery. Inferior thyroid artery is a branch from first part of the subclavian artery, thyrocervical trunk. Whereas superior thyroid vein and middle thyroid vein that drains into IJV. On the respective sides, inferior thyroid vein on both the sides will drains into left brachiocephalic vein. This is the only important anatomy variation. Sometimes they may ask you questions about subdiaphragmatic spaces. So on the right side, which lies in between the liver and the diaphragm, and the right subhepatic space which is a Morrison's pouch which is in between the right kidney and the liver. Left subhepatic space between the portion of liver and the diaphragm. The left subhepatic space lies between the lesser sac which lies between the kidney and the stomach. So they may ask you about Walden's ring, which is the nasopharyngeal tonsil on the roof, tubal tonsil on the eustachian tube, palatine tonsil on the either sides of hot palate, lingual tonsils on the tongue. So, what is a very important anatomy with respect to palatine tonsils? Palatine tonsil, a nasopharyngeal tonsil, and lingual tonsil constitute the major part of Walde's ring. So, which is nothing but mucosa associated lymphoid tissue with the tubular tonsil and lateral pharyngeal band.